there.
What if I told you there was a medical condition that affected 40% of men at the age of 40, that this condition affected 60% of men at the age of 60, and that this condition affected up to 80% of men at the age of 80? Now do I have your attention? Good, because I also need to let you know that this condition could be the first sign of other major adverse medical problems. This condition could be the first sign of a man having a heart attack or a stroke. In fact, 15% of men who develop this condition will have a heart attack or stroke within 7 years. This condition could be the first sign of a man developing diabetes. And this condition could be the first sign of a man developing depression or anxiety. What if I told you this is a condition that many men don't even talk about? What is this condition? It's called erectile dysfunction, or ED. Many of us think of ED as a punchline to a late-night monologue. Come on, many of you have heard these jokes. What do you call a man who gives medical advice about erectile dysfunction? A stand-up guy. I know that wasn't that funny, but I can't think of another medical condition that affects more men's lives, that's associated with more adverse medical conditions. It can have a devastating impact, not only on a man's mental and physical health, but also on his partner's quality of life. And what about women? We don't talk about female sexual dysfunction, or FSD. FSD affects roughly 43% of women in the United States. FSD is associated with low libido, decreased arousal, orgasmic dysfunction, and pain with intercourse. What's alarming is that only 19% of women ever seek therapy for FSD. These women also suffer in silence. Look, I've been treating FSD now for 17 years, and these women don't suffer any less than men, but the treatment options we have for women are just a fraction of what we have for men today. Can you imagine it was less than 10 years ago when the first drug to treat women for low libido was finally approved in the United States? We have to do better. I remember several years ago I was giving a lecture, and I looked out to the audience and I said, please raise your hand if you suffer from hypertension. And quite a few hands went up. I then said, please raise your hand if you suffer from sexual dysfunction. Not so many hands went up. But here's what I know from the prevalence data. Many men and women in that room were silently struggling with sexual dysfunction. Two very important conditions, hypertension and sexual dysfunction. So why is it okay to raise your hand if you have hypertension, but not okay to raise your hand if you have sexual dysfunction? It's time for this to end. It's time to destigmatize sexual dysfunction. And it's not just about destigmatizing sexual dysfunction. It's also about prolonging your sex span. Let me explain. What is sex span? Many of you are familiar with the concept of Healthspan, the portion of your life spent in good health. But when you leave here today, I want you to consider your sex span. Your sex span is the portion of your life where you will have the ability and the desire to engage in sexual activity. With the increase in life expectancy or lifespan, people don't just want to live longer. They want to be able to engage in sexual activity until the day they die. In other words, many people find it important that their sex span lasts as long as their lifespan. So, how do you prolong your sex span? It's simple. 3 easy steps. First thing first, focus on the 4 pillars of health: diet, exercise, sleep, and stress reduction. I don't have a pill on the planet stronger than diet, exercise, sleep, and stress reduction. If you just focus on one of these 4 pillars of health, it can have a profound impact, not only on your sex span, but also on your health span and your lifespan. Second, focus on your partner. Your sex span strongly depends on your partner's sex span. Keep your partner healthy. Keep your partner engaged if you want to prolong your sex span. Many people don't realize that sexual dysfunction is a couple's disease. It's not just about that patient sitting across from me in that exam room. It's also about his or her partner sitting at home. Sexual dysfunction in one partner can equally affect the other partner, and both can suffer in silence. And let's not forget about the benefits of sex. Couples who engage in meaningful sexual interactions tend to have much greater satisfaction in their relationship and in terms of the fact that they're happier in life. And finally, if you want to prolong your sex span, focus on your hormones, especially your testosterone. In men, low testosterone significantly contributes to erectile dysfunction, and roughly 39% of men over the age of 45 have low testosterone. What are the signs and symptoms of low testosterone? Low energy, low libido, erectile dysfunction, increased fat deposition, decreased muscle mass. These aren't just signs and symptoms of low testosterone. These go way beyond this. It's about your health span and your lifespan. Let me give you some examples. Men with low testosterone levels are much more likely to have a heart attack. Men with low testosterone levels are much more likely to have diabetes. Men with low testosterone levels are much more likely to have osteoporosis and break a bone. Men with low testosterone levels are much more likely to have prostate cancer. And finally, men with low testosterone levels are much more likely to suffer from depression. In a study that I published in 2012, we looked at 849 men all over the country who had low testosterone levels. We found that roughly 92% of these men also suffered from some degree of depression. In fact, 17% of these men had severe depression. We treated these men with testosterone therapy for 1 year, and severe depression went down from 17% down to 2%. Now, I'm not advocating to treat major depressive disorder with testosterone therapy, but what I am advocating for is to at least check a testosterone level in men who present with depression. Look, I've been working at the Veterans Hospital now for 17 years. I can't tell you how many veterans I've seen with a diagnosis of depression who've never had their testosterone level checked. Testosterone is a simple blood test that can make a difference in treating a man with depression. Let me say this simply. If you're going to check one blood test to gauge a man's overall health, check his testosterone level. And what about women? Testosterone products have been around since 1935. And if you and I walked into the drugstore today and asked for the testosterone for women, guess what? It doesn't exist. There's not a single FDA-approved testosterone product for women, yet we have over a dozen formulations for men. Just like men, women also suffer from low testosterone. Just like men, women also benefit from testosterone therapy. Which women tend to suffer the most from low testosterone? Postmenopausal women. Many postmenopausal women have low energy, low libido, depression, osteoporosis, decreased muscle mass, increased fat deposition. These aren't just signs and symptoms of menopause. These are the exact same signs and symptoms of low testosterone in women. I cannot tell you how many women I've treated with testosterone therapy who've had a significant improvement in these signs and symptoms. So where do we go from here? First, we must take sexual dysfunction more seriously, with millions of men and women suffering every day from this condition. Tell your partner if you're struggling. Tell your doctor if you're struggling. I believe that sexual health is one of the best barometers of overall health. And by screening for sexual dysfunction, many times we can uncover underlying medical problems. And second, learn the 3 simple steps of prolonging your sex span. Focus on your 4 pillars of health: diet, exercise, sleep, and stress reduction. Focus on your partner. Your sex span depends on your partner's sex span. And finally, if you have signs and symptoms of low testosterone, check your testosterone level. Testosterone therapy can significantly improve these signs and symptoms. And finally, remember that low testosterone can also be a marker of other underlying medical problems. I'd like to end by saying that many of us don't think of our sex span until it's too late, until the damage has already begun. Be proactive about prolonging your sex span. Remember, it's not just about your sex span. It's also about your health span and your lifespan. Thank you.